Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to talk about what the greatest cause of dissatisfaction is with knee replacement surgery. So, right off the bat, I'll tell you what the biggest reason is based on the research, based on the journal articles and the literature out there. What's the biggest reason for people being dissatisfied, unsatisfied with their knee replacement surgery? And that is unmet expectations. So not meeting the expectations of the patient. So what does that mean? Well, it means there's a mismatch between what the patient has in their mind, what their outcome is going to be, what their physical therapy is going to look like, how much resolution of their symptoms and their pain they're going to have. There's a mismatch between what that is and what the reality is and what the surgeon and the surgical team expects. And so first of all, let's talk about therapy. So there's a lot of times where an individual will go into knee replacement surgery and think that, I'm going to have the surgery, it's going to be a little bit rough, I'm going to have some pain, some discomfort, I'm going to go through rehab and recovery, it's going to be maybe a couple weeks, maybe 2-3 months, but after that I'm going to be discharged from physical therapy, I'm going to be feeling great, I'm going to be back to my normal life, and it's going to be awesome. And the thing is that the rehab and recovery process is a little bit longer than that for most people. Yes, physical therapy for some folks may be only 6 weeks, 8 weeks, 12 weeks or so, but the rehab and the recovery and the healing doesn't necessarily stop after you are done with physical therapy. For a lot of people, the rehab and the recovery is going to take months. It may take a year, it may take up to 2 years to really get back to feeling back to normal, feeling back to 100%. Again, there's a lot of variability in this, but it's not realistic to think that within 12 weeks, 3 months, you're going to feel back 100%. You're going to feel a lot better, hopefully, but the rehab process is a marathon, it's not a sprint. It's going to take time. It could take up to 6 months. For some folks, it takes even a little bit longer than that to really feel like you're back to normal and feeling completely better. So that's one aspect that you have to really think about and really have those realistic expectations about. The second thing is about your symptoms. So people get knee replacement surgery usually have a variety of symptoms. You have pain, you have swelling, you have stiffness and tightness, you have difficulty doing the activities and things that you like to do, you have possibly difficulty with just normal things like walking or going up and down stairs. And with knee replacement surgery, for a lot of people it can be really, really helpful, and some people will get almost complete resolution of their symptoms and feel awesome. For the majority of people, it's very normal and very realistic to still have some symptoms after surgery. So still have some pain that decreases slowly over time. Still have some swelling, some stiffness and tightness. These things are very common. Now, as you recover, as you heal, as you build up strength, these symptoms will hopefully diminish. They'll diminish in the intensity, they'll diminish in how frequently you experience them, but it's very common to still have some lingering symptoms every now and then. Now, the thing is to keep in mind is for the vast majority of people, how they feel before surgery compared to how they feel after surgery, they would absolutely still go ahead, and if they had to do it all again, they would still have knee replacement surgery, because there still are tremendous benefits in terms of improved mobility, improved ability to tolerate the activities and things that you want to do, and just being able to function normally and healthy. Now, there's still going to be some of those lingering symptoms, but you have to keep that perspective of, what did you feel like before knee replacement surgery, and now where are you at after knee replacement surgery? And although you still aren't 100% and have 0 symptoms, you really, for most folks, have a significant improvement after surgery when all is said and done. So that's another thing to keep in mind. And then the other thing is just in terms of activity levels. So there's so many activities and so many things you can do after knee replacement surgery. The thing is, though, each person is an individual. Each person has to consider their own physical functioning, physical abilities. So although you're going to be able to, it's totally realistic to try hiking and walking and golfing, doubles tennis, skiing. There's all sorts of things that are potential and that you are absolutely possible, but again, you have to consider your own physical limitations and you have to have a realistic perspective going into it. You're not going to feel like you did when you were a teenager or 20 years old, but you are, for most folks and the majority of people, are hopefully going to feel a lot better. So when it comes to satisfaction with knee replacement surgery, be sure you have some perspective. Be sure you set up expectations. You can be positive, you can be optimistic, but make sure those expectations are realistic and in line with what your surgeon's telling you, what your physical therapist is telling you. There's a ton you can do, but you have to be realistic and have an open mind and good perspective. Thank you very much for watching. Please hit that like button if you got something useful out of this video. Be sure to leave your comments and questions below. I try to respond to everyone I get. And please be sure to subscribe if you're interested in all videos related to knee replacement surgery, frequently asked questions, preparation, recovery, exercises, and everything else in between. Thank you very much for watching.